Hello, I am Dr. Han Joong Keum, a neurosurgeon at Wooridul Spine Hospital. Today, I'd like to talk about spinal stenosis, one of the most common spine conditions, which can result from a variety of causes. Let's explore how to determine the most appropriate treatment when multiple conditions exist together. It's very common for patients to be told at the hospital, "You have spinal stenosis," without a detailed explanation. Stenosis simply refers to a narrowing somewhere in the spine that compresses the nerves. To break it down further, there are types such as central spinal stenosis or foraminal stenosis, depending on the location. Most of the time, there is an underlying cause behind the narrowing. This may include disc herniation, ligament thickening due to instability, or even advanced disc degeneration leading to vertebral slippage and instability. There are many ways to treat these conditions. Patients often ask questions like, "I was told I have a disc problem. Should I just treat the disc, or I have both a disc problem and stenosis? How should I approach treatment?" Any structural change in the disc is referred to as disc disease. When a disc protrudes and presses on a nerve, symptoms such as back pain or leg pain tend to become more prominent. In this case, the diagnosis is stenosis caused by disc herniation, so treating the disc first becomes the primary strategy. Treatment typically begins with conservative measures such as medication, physical therapy, or injections. If those are ineffective, surgery may be considered. By addressing the disc, the stenosis is often resolved as well, making disc treatment the initial focus. On the other hand, if degenerative changes cause ligament thickening or vertebral slippage, then disc treatment alone is insufficient. In such cases, surgery to remove the thickened ligaments or stabilize the slipped vertebrae is required. The treatment plan must be adjusted accordingly. Yes, identifying the cause is crucial. Determining why stenosis occurred helps guide the appropriate treatment strategy. If the issue is a simple disc herniation, treatment usually involves removing the herniated portion. This can be done through various approaches, from endoscopic to microscopic surgery. If the stenosis is caused by ligament hypertrophy, then removing the thickened ligament is necessary. If vertebral slippage is also present, stabilization procedures may be needed. These range from minimally invasive endoscopic surgery to spinal fusion, which involves inserting screws. Because there are many different treatment options, it's important to perform accurate imaging and make a precise diagnosis before deciding on a treatment plan. Of course, experience helps guide treatment selection, but some cases are more complex and require tailored strategies. At Wooridul Spine Hospital, our medical team holds joint meetings, called Friday conferences, to decide on the best treatment plans. This is one of the greatest strengths of our hospital. For example, many patients receive only injections or medication at other hospitals, but these approaches may not be sufficient over time. As the condition worsens, a more comprehensive treatment plan may be required. In advanced cases, patients may develop serious complications or long-term effects if not properly treated. But that doesn't mean we give up. Instead, we make informed treatment decisions, often during these multidisciplinary conferences. Some patients come in with multiple issues: disc disease, ligament hypertrophy, vertebral slippage, and even severely weakened or deformed bones. They often ask, "How can this be treated?" rather than saying, "There's nothing more we can do." We combine procedures such as spinal fusion and spinal ligament reconstruction to perform surgery with the least possible burden on the patient. In complex cases, a single posterior approach is not enough. Sometimes anterior or lateral approaches are used to insert implants for better spinal stability. We perform what we call team surgery, where specialists in different approaches work together for a more comprehensive and effective outcome. So when you ask, which should be treated first when there are multiple spinal conditions, the answer depends entirely on the cause of the symptoms. With an accurate diagnosis, we can determine the most appropriate treatment. The more treatment options we have, the more we can offer our patients. At Wooridul Spine Hospital, we perform everything from minimally invasive endoscopic procedures to complex spinal deformity surgeries. This wide range of capabilities allows us to deliver precise, personalized care which we believe is one of our biggest strengths. This has been Dr. Han Joong Keum from Cheongdam Wooridul Spine Hospital. Thank you.